Hello, I'm Christy Nelson, and welcome to another edition of 5 Talk Street. More than 55 million Americans are enrolled in Medicare, and more than 10,000 baby boomers become eligible for the program every day. But a United Healthcare survey found that 70% of people approaching Medicare eligibility only have a fair or poor understanding of the program. And Lindsay Edwards is with United Healthcare in Dallas. She's here to help us clear up some of the confusion about this program. Thanks for joining us today.
Thank you for having me.
So what confuses people the most about it?
I believe it's because there's so many parts of Medicare, but the time of year is here and open enrollment is upon us. It starts October 15th. And so there's a lot of resources and places where our Medicare beneficiaries can go to get that information and hopefully help them understand the program a lot more.
Okay, so there are all these different parts, A, B, C, and D. What should people be focusing on right now? What should they know as they try to make their decisions for open enrollment?
Well, you need to know that every year your plan changes. And so you need to really look at your current plan and look at your co-payments, your premiums, because every year those things change. And so everyone should receive an annual notice of change from their current carrier that will detail those changes and current details of their plan for them. But really, open enrollment is the time of year. Again, it starts October 15th, and it's very critical that our Medicare beneficiaries look through their plan. And if they're currently on original Medicare, this is a time that they can go onto a Medicare Advantage plan. If they're currently on a Medicare Advantage plan, they can look at another option and what have you. So it's a time of year that they really need to look at their current plan, or if they're on original Medicare, at their options.
So let's talk about these parts. Is there an easy way to explain what they mean?
Sure, and I'll run through. It is the ABCs of Medicare, and so Part A covers the cost of inpatient hospital care, as well as skilled nursing, some home health care. Part B covers doctor visits, and Part C, which is also known as Medicare Advantage, typically includes A and B, as well as Part D, which is prescription drug coverage.
So you could choose which of those you need.
Correct. So with original Medicare, you have Part A and B, and then you can choose to go onto a Part C, which is Medicare Advantage, which includes A and B, as well as that prescription drug coverage. So the Medicare Advantage option kind of packages that for you. Also, the individuals can stay on original Medicare and go on to a Part D, which includes their drug policy and their coverage. So there's several options, and it's very crucial that Medicare beneficiaries understand their options. And so there's a lot of resources that Medicare beneficiaries, their families, caregivers can assist them in looking for those options and decisions.
And let's talk about those resources. What is out there to help people better understand this? And I know in some cases when we're talking about seniors, having it online is not something that's going to be the best way.
Right. So if online is not the best option, they can call in to Medicare. It's 1-800-MEDICARE. Also, if online is a good option, medicare.gov. Also, a website that is available year-round for help is medicaremadeclear.com. Really great website that outlines all of those details and helps Medicare beneficiaries make those important decisions.
Now, even though we have all this information out there, is this ever going to get better? Will it be easier for people?
I think so, because as our baby boomers, as you said, 10,000 a day are joining the Medicare program. They are a lot savvier when it comes to using the internet, really utilizing their resources. And I think it's up to all of us to help Medicare beneficiaries, our families, and provide that education. And if we can't help them, hopefully they will go and seek that education that they need, either through that phone number with 1-800-MEDICARE or go online. Because I think really the key to Medicare is education. And all of us play a great part in that, and being a part of our community and helping individuals understand Medicare.
All right. Well, Lindsay Edwards, thanks so much for being here and helping us understand it a little bit more.
Thank you for having me.
Okay. Well, to learn more about Medicare, visit medicaremadeclear.com. And don't go away. We'll be right back with more of 5 Talk Street.